So what if you could learn from your future self? What experiences, what wisdom, what would the future you say about the things that you shouldn't do now or you should do now? How to avoid mistakes, how to make better choices? Well, of course, that's not possible, but what if? Hi, I'm Bruce Spurlock, a physician and healthcare leader committed to helping decision makers navigate change with clarity. On Viral Healthcare, we explore the ideas spreading across healthcare and what it will take to implement them wisely, sustainably, and effectively. On today's question, I want to spend some time thinking about this concept of knowledge. Because after all, that's kind of the point of this podcast. That's the point of talking with people that have different perspectives and experience. Earlier this week, I interviewed Helen Macfie, the former transformational leader at Memorial Healthcare System and a national leader with the Institute for Healthcare Improvement. Really deep experience. And I'm trying to tease out of her and others that I've interviewed on these podcasts, what is it about their experience or knowledge that we can share with people, perhaps younger than ourselves, that will guide them to making fewer mistakes. And you're never going to make zero. But what if we had a better batting average because of some of the things we could learn from others? So let's think about knowledge, that whole knowledge transfer idea that I'm really trying to accomplish, the deep underpinning of the Viral Healthcare podcast. One of the versions of knowledge is explicit knowledge, what you can actually codify, what you can put down in a book, in a journal, in a database, something that's tangible, something that you can get your arms around, and you can study. How about tacit knowledge, the second version? That's really much more of the know-how, the experiential based. I like to use the example of learning how to ride a bicycle. You can't really teach a young person how to ride. You can coach, but they have to learn balance on their own, or playing an instrument, or any of those kind of things. Those are experiential types of knowledge that we call tacit knowledge. And then the third form in this type of categorization of knowledge is implicit knowledge. That's sort of the application of these two different types of knowledge that you have. And sometimes they're not even acknowledged. They're the hidden tribal or shared ideas between people. They're more social exchange of information that is sometimes spoken or even unspoken. So I want to focus today on this tacit knowledge, just sort of know-how, experiential. I want to see if there's a way we can tease out things that you can do, and you don't have to just gain it by actually doing it. Are there ways to accelerate the acquisition of tacit knowledge? And so the example I want to do is ask this question about learning a new language. I'm actually trying to learn a new language, and we don't always think about it when we're children, sort of studying on how to do this. But can we study our way to new leadership heights, better leadership, stronger decision making, better execution as a leader, as an executive in healthcare? So how do we do that? Well, let's take the learning from language example. And I got to be honest with you, I'm not a linguist. I'm not somebody who studies this. I've sort of watched a few linguistic kind of professors and seen a few things about how to do this, but I want to break it down into what I call the 3 Qs of this explicit and tacit knowledge in absorption. So the first one is quantity. There's no question on learning a new language. You just have to do it. I mean, there's drilling, there's memorizing, there's just time and energy put into studying and trying to understand the new language, both the grammar rules, the spelling, all of the different components of the linguistic acquisition of information exchange using the concept of language. And language is super powerful for executives. The second part is quality. So that's the first Q is quantity. The second one is quality. How do we improve the quality of our language adoption? How do we learn the quality? And part of this is not just studying a lot, it's studying the right things, studying failure, studying how things work or why they work, or asking questions about why things happen the way they do. So it's really studying the right kinds of things and not just studying things in mass quantities. So there's quantity and quality. And the last Q that I want to talk about is questioning. And I tried to come up with a word that was similar to this curiosity, but I thought questioning was really good. What if we had this learning mindset? What if we had this, I want to understand, I want to discover, I want to I want to just sort of uncover sort of new information, new ways of thinking about it that I perhaps haven't. I come in with blinders, I come in with biases, I come in with perceptions that might be limiting in some ways. And so quantity, just practicing over and over again, and really spending time thinking and studying. The second one is quality, studying and trying to think about the right things and learning from failure in particular as a way to be effective. You always remember your failures the most, and that's kind of the things we should study the most. And then bringing this questioning or curiosity mindsets to where we always are interested in discovery and growing and expanding our horizons about it. The two themes that I think go through all of this in this concept of explicit knowledge, tacit knowledge, and implicit knowledge is that it takes discipline. That the 3 Qs take discipline. You have to do them repetitively. You have to do them when it doesn't feel like it's fun. You have to do it when you feel like you're not making much progress. I mean, you have to be unsuccessful in anything you do quite a bit before you can become successful. I mean, you cannot play on Wimbledon without years and years and years of training to be able to do that. You can't give a great speech in front of an audience without years and years of practice and experience doing that. But you can study how great speakers work. You can study how great athletes are successful. You can learn from them to accelerate and take a shorter path to getting there. It's the same with executive decision making. It's the same with implementation. It's the same thing we're talking about in viral healthcare. Discipline, and then finally the last message for the day is persistence. So you need to be both disciplined, do it when you don't want to, do it regularly, do it because it's the right thing to do, and then persistent, keep doing it. We underestimate what we can accomplish in 5 years and overestimate what we can accomplish in 1 year. So the goal is to think long range when you're trying to say, what would my future self tell me today that would help me avoid problems, go more quickly, be more successful in the future endeavors that I'm trying to do with my organization. If you enjoyed this conversation, we're here every Tuesday morning at 9 and on Reflections on Friday. Join us and talk about these things. Share with me your ideas, your questions, your successes, your failures. We'll be able to exchange these things so that we can all get better, so that we don't have to wait to the future. We can actually get there a lot faster than everybody else. I'm Bruce Spurlock, and I'll see you next week.